Okay, so welcome to Module 4 of the online caregiving diploma program. And Module 4 would essentially talk about what it takes to care for the elderly. So it's titled Working with the Elderly. Now, this module is devoted maybe facing. We'll also begin by looking at social factors that will change as people age. We'll then explore all the different body systems and look at how the body and mind changes as a person ages through their lifespan. Then finally, we look at it and some special cerebrovascular accident called stroke, Alzheimer's disease, Parkinson's disease, and of course, how to work with persons who experience such challenges. So aging is a normal physical and psychological process that all humans will go through as they move through their lifespan. Everybody will eventually age. And lifespan means the length of time that a person or a living thing can be expected to live. As people age or they get older, there are many changes that begin to occur within their bodies. Some physical changes, even within their minds and behavior, psychological changes. Now, these changes are known. These changes are known as human growth and development, and they're unique to each individual. No two individuals will age the same way. So everyone has different experiences as they move through the lifespan. The psychological factors of each individual, environmental, even societal factors such as the stress and the financial situation that an individual has experienced will impact their pattern of development, their pattern of aging. Then also our biology or genetics. Genetics summarily will be a person's gene. Would also have a strong influence on how people will develop and the physical changes that will occur as they begin to age. Then individuals who suffer from diseases like heart diseases, infections, strokes, or people who use substances like alcohol and drugs, cigarettes, will also be affected by this as they begin to age. So it will have physical changes on their body, on their mind, eventually. So each person will have different experiences of development throughout their lifespan, and this will result in development being a unique and an individualized process for each person. So it's important that you understand the general physical and psychological changes and stages of development that human beings would ordinarily go through from birth till death. And it's even more important to understand that there are no two people that will go through these stages in exactly the same way. No two persons would experience birth to death exactly the same way, even if they are a set of identical twins. So you want to keep in mind that each person is a unique individual, and you would interact and take care of your patients like so. So now changes in family structure and the role that a person has in the family also occur throughout the lifespan. But when elderly people who are the head of the family get older, these roles may begin to change. For example, an elderly person may not be able to provide for their family financially and physically. Younger members of the family may need to take on the role of financial provider or the caretaker of the family. So it's important that the families make adjustments to accommodate such change throughout the lifespan of the elderly individual, because this can be both emotionally and physically difficult, both for the elderly person and the family member who needs to step up to fill such a role. Okay, so you would need to have some really good communication skills as you work with the elderly people who are facing these changes. So the communication skills we discussed in Module 2, they are good tools to help you assist patients in dealing with new emotions. So it's important that you're sensitive to the adjustments that your patients and even their family would make in view of the processes of aging. So your job as the caregiver must be performed well. And issues that are out of your competence, you want to refer to your supervisor then it's important you remember to just empathize with the family members. So if a family member comes to you with a problem, you want to listen to their concerns, even if you are not able to solve it. Because sometimes just talking about a problem can make your family member, your client's family member, even your client in this case, feel better about the problem. So your communication skills, your listening skills has to be optimal. So, and when you listen and you're trying to make the person feel better, it's important, as we discussed earlier, in module 2, that you want to paraphrase what the person says. Okay, so I heard you say this. If I got you right, this is what I heard you say. Then you want to summarize the feelings that they are conveying. So what I hear you say now is, this experience has been painful for you and you feel bad every time you reflect about it. It makes the individual feel that you're staying with them, you're tracking with them. Then you want to demonstrate empathy, as I said earlier, and positive regard towards the patient and their family member. Positive regard is unconditional. Even if it looks to you like they're falling apart, they're not handling it as you would have. Unconditional positive regard is not with sentiment. You just regard the person because the person is an individual, is a human being like you. Then you want to observe and report changes. As you work with your elderly patient, you will come to have a first-hand knowledge of the physical and psychological changes that occur during the aging process. And you may also come to recognize and be the first to notice signs of a new disorder or disease process that is not even in any way related to the aging process. But many times this may be mistaken for and is regarded as just aging. For example, it's not normal that as people age, they begin to lose memory. So dementia is not a normal part of aging. It's a disease condition. So if your patient suddenly begins to show signs of increased forgetfulness more than before, they have difficulty concentrating, they are disoriented, like they are unable to recognize themselves, where they are, what year or season it is, or even events that are occurring. You want to immediately report these signs to your supervisor, and these signs are not necessarily due to just aging. I just want to reiterate that there could be signs of stroke, dementia that is related to Alzheimer's, or a vascular problem within the brain, or it could even be that oxygenation within the brain is inadequate. Okay, so if you, the home caregiver, notice any of the following, especially if they occur suddenly, you should immediately report them to your supervisor. Disorientation, as I said earlier, your patient does not know self, does not know a place where they are, does not know time. You ask them, what time of the day is it now? If you look at the sky outside and it's a bright day and your client tells you, I think it's night, that's a disorientation to time. Or the person doesn't know the event. Your client is eating and you ask, what are you doing, ma? And she says, I'm sleeping. That again is a disorientation to events. So you want to inform your supervisor ASAP. Okay. Then if your client has difficulty concentrating, which is different from the ability to concentrate before, they have difficulty speaking, chewing, swallowing, or if they exhibit some form of depression and that is not their routine affect when you initially start working with them, or if they express suicidality, that's statements of wanting to die or hurt oneself, if their moods begin to change or there are sudden shifts in moods from being happy to being depressed, or if they have difficulty getting to sleep or even staying asleep. So the elderly person may wake up in the night and is just roaming the compound or the house. You want to inform the supervisor. Then if your elderly patient has anorexia is lack of appetite for eating, or they have inability to use a limb, arm, or leg, or there's drooping of either one side or both sides of the face, like the face drops down visibly, that you know there's a sagging of the flesh of the skin of the face. Then if they have a lack of balance or coordination, they're walking and they're staggering. If they have changes in grooming or self-care, this is an elderly person who will dress and look really kept. But now you see them dressing so shabbily, wearing the wrong sides of clothes, and it's a repeat mistake or error. You want to be sure that there's nothing wrong. Then if they have incontinence, loss of their bladder or bowel function, if something just doesn't seem right to them based on what you already know of the patient, so you want to report to your caregiver, to your supervisor. So it's important To remember that you want to protect your patient's privacy at all times. This means you're providing privacy during self-care, such as bathing, toileting, or dressing. It's easy to forget to do this if you are rushed or if the family caretakers are around. But you want to remember that you are there to care for and protect your patient. It's also important to remember to maintain confidentiality of what your patient tells you about their health. You would only share such information with persons you are allowed to share it with. So, what are some attitudes towards the aged? There's some ideas about the elderly that are often based on stereotypes and depictions of older adults in the media. They're often shown to be helpless, forgetful, slow, have dementia, to even be incontinent. They are unable to hold their urine. They pee all over themselves, or they are unable to live on their own, or they are unable to engage in physical activities. Research has actually shown that majority of older people are active and very involved in life activities. So you also want to keep in mind not to call them some names that are often depicted in social media, like cute, honey, dear, so that these names are actually derogatory and condescending. So you never want to use such on your elderly patients. You address them properly as Mr. This or Mrs. This, except the individual requests otherwise. Maybe he or she says you should call them by their first name if they are someone with such mindset. Okay. And when you speak with your elderly patients, you speak with respect and allow them to make their own decisions and choices as much as possible. You about them, you give them options of one or two and ask them to make a choice. Piece of clothing, give them options of maybe 1, 2, 3, and ask them to make a choice. So just so they still enjoy their sense of independence as much as possible. Then do not treat them like a child. Just because they may be dependent on others for their care does not mean that they are children. It just means that they need a little extra help. Please be respectful towards your elderly patients. Now, magazine and television advertisements many times focus on youth and equate it with beauty. So this leaves the impression that the young is beautiful and good, while old is ugly and bad. This is a stereotype, and it can result in something called ageism. Racism, which is studied in Module 2, is discrimination based on someone's race. Ageism is discrimination against someone based on their age. Ageism is harmful to older people and can result in depression, anger, loss of employment, loss of housing, and loss of emotional support. So what are some myths about aging? As many of the patients with whom you'll be working with will be elderly, it's important to learn about the aging process and to avoid engaging in ageism. So some myths that we'll review are, a common myth is that all elderly people are alike. As we age, we actually become even more uniquely different because the elderly people have had unique life experience. So they are a diverse group of people, just like any other age group. Another myth is that most elderly people are senile or they have dementia, that they forget things, their memory is not too sharp. Dementia, again, we said it earlier, is not a normal part of aging, it's a disease process. So you observe that, you want to report to your supervisor. It's not something you will see as, it's just a normal part of aging. Another myth is that the elderly have no worries once they retire, as they can enjoy their life. No, many elderly people have many worries as they age. Some of them are facing financial constraints. Some of them are facing loss of their social stature because, of course, they can't deliver as they used to when they were much younger. Some of them are facing loss of social connections. Their age groups are beginning to die. Their children have moved away, so they are in that empty nest syndrome phase. Some of them are facing health problems. The fact that your care is even needed means that they are losing some independence in some ways. So they have some worries as every other age group would. Another common myth is that elderly people no longer desire or have sexual relations. No, the truth and what research has shown is that most elderly people continue to have a normal sexual relation until later in life. So that could mean that your client is a married person. Please give them the privacy and the respect they need to be able to attend to their own sexual needs. Okay, so most elderly people are set in their ways and will not change. That again is false. While older people may be slower to change their opinion than younger people, the majority of elderly people are open to change. In fact, they will face many changes due to changes in physical health, in social connections, in deaths of their loved ones, and illnesses. There's always a change happening. And many times they would need to just adapt and make do with the next phase that life offers them. Okay, a sixth myth is that elderly people are unproductive and uncreative. That again is false. Many elderly people continue to be productive members of the society. The society can learn from their can glean years of wisdom from them, from the life experiences they've had for decades past. So even though many elderly people have retired, some will continue to work in order to meet financial obligations or just to remain active. So outside of work, elderly people may also volunteer in their community, be involved with their families, or serve as caretaker for grandchildren while their children are at work. So it's important, as much as your elderly person can, the elderly client can do by way of productivity and creativity, please encourage them. Okay. So the seventh myth is that elderly people have a hard time learning and are less intelligent than younger people. Again, that is false. All age groups learn at different rates and in different ways. Now, the truth is, older people have intelligence from life experiences that younger generations oftentimes do not have. So they can offer valued wisdom based on their own life experiences to others around them. Research also shows that while we do lose brain cells, we continue to gain new ones and to build new connections within our brain. So the best way to build new brain cells is to remain active and continue learning throughout lifespan. So you want to encourage older people to continue learning. For someone who is educated, you want to continue encourage them to read newspapers, to read books, to read non-fictions, even if that means you're sitting and reading it to them, or just learning anything that is of interest to them. Okay, so the elderly people are grouchy and hard to get along with. That's also another myth. That is false, because this is a stereotype that is often seen in the media. People tend to be grouchy and have a hard time getting along with people when they are younger, will likely continue to do so when they're older. So it's not across board. It's not, it would be an unfair generalization of the elderly populace. Research actually shows that our personalities are generally set by the time we're 30. So an individual who is grouchy by the time he or she is 30 will likely continue to be that way into when they're elderly, except something happens that changes such a pattern. So happiness has nothing to do with aging. And in fact, the late years can be some of the happiest times of people's life, and they may have more freedoms than they did when they were younger. They may be more confident, secure in themselves than when they are younger. So the ninth myth is that most older people fall from time to time. I said it in maybe 3 or so, that although fall risk does So the ninth myth is that most older people fall from time to time. This is not true. If a patient falls, the cause of the fall should be investigated. This can be due to a number of things: medication side effects, the fact that the elderly person is unwell. It may just be household hazards, some footwears that are not appropriate, some rugs that are loose. So that is a myth. The 10th myth is that most elderly people are incontinent, meaning they are unable to control their bowels, to control their poo and their pee. Bladder and bowel incontinence can affect people of any age. The risk increases as people age, though, because of loss of muscle tone. But it's a stereotype to assume that all elderly people are incontinent. Now, if the elderly person you care for was not incontinent before and develops a new onset of incontinence, your supervisor should be informed, because it needs to be investigated right away. It could be a sign of urinary tract infection, maybe a side effect of medications that have been administered. It may even be that your elderly person has some imbalances in the electrolytes. Okay, and with that, we come to the end of this presentation. And as always, thank you very much for staying with me. All right. Thank you. Bye.